I think one of the things that in my career, and as I've progressed in my career, I've recognized the value of more, is identifying mentors within an organization that you're either working at, and also mentors in the community. They don't necessarily need to be somebody that you work with on a day-to-day basis. And some of that mentorship can be formal, some of it can be informal. And I think what a challenge for me was, especially when I was younger, earlier in my career, was that you had this sense that you had to figure it out for yourself, by yourself, as opposed to going to people and relying on them for their expertise and experience, either in your field or in fields that are tangential to yours. As I've progressed in my career, and especially at this role at Catholic Health, over the first few years that I was here, I identified a few senior folks, not necessarily within my departments or in my kind of chain of command, but just senior in the organization in other functional areas, and approach them and ask them to serve as mentors for me. And so what I've been able to do, number one, they can provide a different perspective. Number two, when you need some help, they can provide you with some help. And also you're going to get some exposure to other parts of the organization that you wouldn't have otherwise done or been able to do. People that are later in their careers, they're looking to help the next generation along. And so you want to make sure that you tap into that. You're not going to be able to do it all by yourself. You want to have a support structure around you. So I think there's an opportunity there where you're not only learning technical skills within those roles, but also leadership attributes. And there are continuing to be growth opportunities along the way because of that within my career.